Have you ever seen pictures of yourself 10, 20 years ago? Someone sends it to you, maybe on social media, and you go, wow, I looked younger then. One of the things you're going to notice in those pictures is the fact you had more facial fat in the right areas. And now, as we age, facial fat moves to where we don't want it. The lower face, the jowls, but fat is a good thing. By the way, did you know you should never assess your face in the morning? That's because it's puffiest at that time. That's from the redistribution of fluids in your body while you sleep. It usually resolves within a couple of hours, so don't wake up and start your day like that. And today, I'm telling you how in my clinic, I restore facial fat, restore facial volume, and the products you might be using at home, like your skincare, like your home devices, might just not be cutting it and giving you the volume, lift, and contouring you want. So you want to go to that next level. This video is for you. One of these is an all-natural solution, so some of you might prefer that. This is one of the reasons why skin boosters are all the rage for 2024 and beyond, but not many people, nor do many practitioners, want your face full of cross-linked hyaluronic acid. Let me rephrase that. The practitioners that know how to use things other than hyaluronic acid fillers don't want them in your face to the extent many are getting them. It draws water in and it can last for many, many years. So the solutions today are not with fillers, but I'm going to talk to you about biostimulators, 3 in particular that I use commonly in my practice that you want to consider for a youthful look. Now, a lot of them also give you skin glow, increased dermal thickness, and help make your fat pads more youthful. The number one I'm going to talk to you about is Sculptra. Before Sculptra was in the United States, it was in Europe, and it was used for HIV lipoatrophy. So it was actually well studied for facial volumization, and a lot of people would bring it. There was actually a compassionate use program that I was involved in that patients could bring it from another country and use it because it made such a difference in people's lives. Now, Sculptra is PLLA, poly-L-lactic acid, and in the vial, the particle size will be very specific with real Sculptra because we don't want too big of a product or molecule that will then be seen as to the body as a foreign body, and you get a foreign body reaction called a granuloma, which is a type of lump or bump. There's many reasons you might get this. The other reason is you need to see an expert, someone who's injected this quite a bit, because the layers, the way we use it, are what's called off-label. The best way to get the best results are not the way it was intended on the FDA approval. Very common with products. Don't get caught up in that. But you want to know you're seeing someone that uses a lot of this product, has used it over time, because the PLLA bead is not dissolvable, but it goes away from your body over the next 3 to 20 months. The collagen that you create and the volume that it reproduces is yours to keep for a longer period of time. In the studies, 2 to 5 years. People who maintain their skin, who use good skincare, get an even longer result. But the results that you can get with this product are amazing. It has a very high safety profile. And by the way, did you know that biostimulators like Sculptra are being used almost 40% more this year than last year? And guess what? Fillers are down by almost 35%. What's that telling you? We're on the right track here. Number 2, let's talk RADIESSE. Now, RADIESSE is very accessible to people because it can be obtained by clinics at a lower cost. In a vial of RADIESSE, 70% of the vial is not the biostimulator, but what we call a carrier, carboxymethylcellulose. This will be gone from your body in about 3 months. The calcium, which is 30% of your syringe, that will maintain in your body for many years, and that's what's stimulating your collagen. Why I'm telling you this is because with RADIESSE, a lot of the immediate volume that you see will go at the 3-month mark. And so a lot of people by 3 months are a little disappointed. It just means you need to add a little bit more. Over time, you will get nice volumization. The results of RADIESSE often aren't as long-lasting as Sculptra, and a lot of times you don't get the skin glow and dermal thickness increase that you get with Sculptra. But it is a little more expensive. It's a great alternative, and the benefit of RADIESSE is that you're going to see more immediate results. The reality in clinical practice, patients just love the immediacy of things, even though you tell them, well, something's going to last you 2 to 5 years, but it's not that immediate. They tend to go for the immediate. Just our human mind, people like immediacy. Number 3, all natural. Here's what an all natural treatment looks like. These are 15-month follow-ups. You see just a natural rejuvenated look, more glow, some lifting, and interestingly, the brown spots go away. When you're adding growth factors and exosomes back, what you're doing is rejuvenating your fat, your skin, your bone to, in effect, boost the mechanisms that already exist. And all this without adding anything exogenous or chemical. We call it autologous. Now we have the technology. We draw your blood, we spin it down. What are we doing? We're concentrating your growth factors and your exosomes. We'll leave it at those two for now. There's many other factors, but growth factors you know from growth factor in skincare, and exosomes you know from exosomes likely in skincare. These are all regenerative properties that help create better, more robust, more volume for your existing fat. But there's no additives here, unlike in Sculptra or in RADIESSE, where it's man-made. This is all your own body spin. We can take a component of your blood, also heat it up, allow the proteins to unfold, and we get a gel-like carrier or filler from your own blood. Absolutely amazing technology. With these, I want you to keep in mind, who does your procedure matters again, because as you spin the blood, if it spins in the wrong spinner, in the wrong tube, if it's too fast, well, you're not going to concentrate your exosomes and your growth factors. And so many practitioners don't take the time to learn this. They believe they can just spin your blood in any way. If it kind of looks right, yeah, that's probably good. We'll inject it in your face. But it needs to be a studied system that we know that the exact spin produced those growth factors and exosomes. So like with a lot of these procedures, who you see, what they use, and their mindset matters. Now, when this product is made, and it takes about 20 minutes to process your blood, then it's dependent upon the injector to inject it in the right layers, in the right amounts, to create the aesthetic, artistic look that you want. So there's a lot at play here, but as long as you find a practitioner who's passionate about what they do and has been doing something for a long time, you should get great results. And understand with all these, what we call biostimulators, to a degree, we're depending on your own body's machinery to build collagen, to thicken your dermis, to make your fat pads better. So the healthier you are, the more you're eating properly, the more you're on the proper supplements, the more you're avoiding sun damage, all the healthy behaviors you have and that you've lived your life. And if not, you make those changes. For instance, stopping smoking, stopping drinking excess alcohol. All those things will give you a better result. But it's much better than having a face full of fillers that draw water in, that make you look bloated, that can migrate and move around. These are biostimulators. Now you're going to want to watch this video on me getting my plasma fill, my blood draw type of filler in my face. I take you through the whole process, and you can watch me and, of course, my before and after. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.